Let's talk about one of the most common and honestly one of the most frustrating injuries out there for anyone who likes to be active. I'm talking about that nagging pain right behind the kneecap. You've probably heard it called runner's knee. If you've ever felt it, you know exactly what I mean. It can totally sideline you. So today, we're going to figure out how to solve it for good.
So, does this sound familiar? You're out there, you're moving, feeling great, and then this persistent, really annoying pain shows up right at the front of your knee. And it's not just a little tweak that goes away, this one kind of sticks around.
Maybe you feel it the most when you're just walking down a flight of stairs. Or, after sitting through a long movie, that's the classic moviegoer's knee, maybe deep squats feel just about impossible. If you're sitting there nodding your head right now, you are definitely in the right place.
Look, this is an incredibly common issue, so you are not alone. But here's the best part. We have a ton of really solid research on what actually works to fix it. So let's dive into the science of a real solution.
Okay, first things first. Before we can even talk about the right solution, we have to tear down all the wrong ones. There are so many myths floating around about this knee pain, what we call patellofemoral pain, or PFP, and they can seriously get in the way of you getting better.
The first big myth you hear all the time, especially with younger athletes, is, oh, don't worry, you'll just grow out of it. Well, it turns out the research tells a very different story. For a lot of adolescents, this pain doesn't just vanish. It actually follows them right into adulthood if they don't actively manage it. So here's the bottom line. Just waiting for it to go away is not a strategy.
And here's another huge one, blaming your body. I just have flat feet, or my Q angle is too wide. The science has really moved on from this idea. We now know that these kinds of structural things are not significant risk factors. It's not about the body you were born with, it's about what you do with it.
So if it's not our anatomy, what is the real cause? Well, it almost always comes down to one single powerful concept: overload.
The real culprit is something called relative overload. And in simple terms, it's really just a training error. It means you asked your body to handle a workload, more miles, more hills, more jumps, that it just wasn't ready for yet. It is the classic case of doing too much too soon.
And this isn't just a theory. As expert researcher Dr. Rich Willey puts it, the pain almost always kicks in after a sudden spike in activity. Maybe you decided to double your running distance overnight, or you jumped into a new intense workout plan. That spike is the trigger. See? This isn't a structural problem, it's a loading problem. Okay, so if the problem is too much load, you might be thinking, great, the solution is less load, right? Well, not exactly. The real fix is to build a body that can handle more load. The fix is to get stronger.
And this is a hugely important point. The old advice was to just stop everything and rest. We now know that complete rest is actually the wrong thing to do. The gold standard, the standard of care backed by a mountain of evidence, is exercise therapy. You have to get moving to get better.
So what kind of exercise are we talking about? Well, strengthening is key. Now, strengthening your quads, the muscles on the front of your thigh, is fundamental. But the research shows something fascinating. When you add hip strengthening to the mix, the results just skyrocket. We're talking 44 to 80% greater improvements in pain. Why? Because strong hips give you stability from the top down, which helps control how your knee moves. You got to strengthen the whole chain.
Now here's a concept that might feel a little strange at first. You don't have to be completely pain-free while you're doing your rehab exercises. In fact, experts actually recommend allowing for a little bit of pain, say a 2 out of 10 on a pain scale. This makes sure you're actually loading the tissue enough to make it stronger without causing a big flare-up the next day. So a little bit of pain is okay. It means you're in the right zone.
So getting stronger is pillar 1. Pillar 2 is all about managing your current activity. The goal is not to stop doing what you love. It's about modifying it intelligently so you can keep going while you recover. It's about training smarter, not just harder.
Let's look at a couple of real-world examples. For a runner, the problem might be those high-impact strides, especially on hills. The fix, instead of stopping completely, try increasing your cadence, your step rate, and stick to flat ground for a bit. For a basketball player, maybe it's just too many jumps in one practice. The fix is to work with your coach to temporarily limit the total number of jumps you do. It's all about finding what's aggravating it and just tweaking.
So for all you runners out there, here's a super practical guide. The most important rule is to try and keep running if you can. A simple 5 to 10% increase in your cadence, which just means taking slightly shorter, quicker steps, can reduce the load on your kneecap by up to 20%. That's huge. Pair that with sticking to flat ground for a little while, and you've just created a perfect recipe for active recovery.
So, we have our two pillars, get stronger and manage your load. But there's a third, final piece that ties this all together, and honestly, it might be the most important one. It's all about your mindset. This is how you turn a short-term fix into a long-term solution. Let's just address the biggest fear head-on, right now. A lot of people think that feeling this pain means they're damaging their cartilage or ruining their knees. Let me be very clear. The science says you are not. The cartilage in your knee doesn't even have nerves. The pain you feel is not a sign that you're destroying your knee, and just reassuring yourself of that fact is a critical step to getting better.
Now, what's really important to understand about PFP is that it has a high recurrence rate. The goal isn't some magical one-time cure. The goal is a long-term management strategy. Think of it like this. Your knee is just a sensitive area that lets you know when you've done a little too much. And those strength exercises we talked about, they become your permanent tools for keeping that sensitivity in check. And as Dr. Willie concludes, framing this as an injury you manage is absolutely key. It might come and go, especially if you overload it, but by having a successful management program in place, your key strength exercises, and your smart load adjustments, you will always have the tools to handle it whenever it decides to flare up.
So, the biggest takeaway here is this: patellofemoral pain is not a life sentence. It is not a sign of bad knees. It's a loading issue, and it is highly, highly manageable. You now have the tools, getting strong, managing your load smartly, and having the right mindset. The only question left is, are you ready to take control?